This program is brought to you by Teachers College, Columbia University. Please visit us online at itunes.tc.columbia.edu.
Good afternoon to everyone. I'm a little bit vertically challenged, so you may just see a talking head for a while. It doesn't help that the lights are shining directly on, so I can't really see the screen very well, so bear with me. I just wanted to just go back a little bit and speak a little bit about what Professor Wallace, Dr. Wallace, said this morning about the importance of really keeping that A equals B dynamic. It is so important to make sure that we are talking to each other, that we are engaging in dialogue, that we are really addressing all of the issues on an equal basis, that we are not looking at the hierarchy. And as I decided to create a topic called Focus on Failure, I challenge you to really think about what that actually means. Focus on failure. We could look at it in two different ways. We could say we're focusing on the areas that don't work just for the sake of it, giving us all the opportunities to make excuses for what we are unable to do because of lack of funding, because of lack of staff available to do what they need to do, because of many different reasons. However, I really challenge you to look at the second component of that, because when we're focusing on failure, it's really looking at the different opportunities that we may have to find all of those areas where we have weaknesses and really take those weaknesses and create strengths from that. We're going to look at the areas that haven't worked and then change those so that we could learn from them, gain experience from them, and collaborate with other groups in order to make the real models of success. If we start looking at what those models of success are, we're looking at two kinds of failures, and we know that there are those who think and never do. Theoretical constructs are really important. We need to know what's behind it. We need to be able to plan things appropriately. However, if we remain forever in the planning stage and we are afraid to take the next step to implement those things that we're actually planning, then it's really a moot point. What are we actually accomplishing? We're really not able to learn, because as we know from all of the different discussions that have taken place, many things that happened that we're able to put together theoretically are really not able to be, we're not able to fix them, we're not able to evolve with them, we're not able to change them without the opportunity to really practice what we are talking about, to really focus on some of those different areas and using all of those things, those failures, those things that have not worked well, to really move forward and propel us in another area. And then again, those who did and never thought. We're talking about health disparities. We're talking about all of the different, the cultural issues, the many things that pose barriers for people to receive the services that they need. However, when we do things without thinking, it is the formula for failure. And we want to make sure that not only do we take the time to think about it and organize the things that need to be organized, but that we also take the time to take those things and put them to practice so that we make them work. So it really becomes the balance of the two. And as remember that there are two benefits to that failure. First, that it gives us the opportunity to find out what doesn't work. We tried this, we tried it with a certain population. Maybe it was a great formula when working with children, when working with one special population, when working with the housed population. But when we try that same formula, that same plan, and we work with a homeless population or an adult population, we find that it may not work so well. So it's really, again, taking the idea and tailoring the program to the population that we're working with. And secondly, it gives us the opportunity to try a new approach. If it didn't work this way, let's try it a different way. Let's modify it just that little bit to make sure that we're actually achieving the outcomes that are not necessarily the outcomes that we want as far as the deliverables for a grant or the deliverables for speaking to your supervisor, but that it actually provides the support and the services that are necessary for those families that need it so very much. And as we're redefining failure as a measure of success, the only way to determine how to do things the right way is to look at what things did not work. So again, it's a repetition of those concepts. What are those things that didn't work? What are those areas that we really need to focus on a little bit more? We achieve success through knowing, to gaining programs about knowledge. We monitor, we evaluate, we modify strategies as we go along. The more we engage in contact with our community of interest, the more we work on all of those different areas that we think really need to be addressed, and the more we really focus on the need for that population, the more we're really going to understand how to monitor it, how to evaluate it, and how to evolve with that process. So as you see, when we're looking at which side of the road we want to be on, are we going north, are we going south? Are we going on the path to success, or are we staying in failure because we are either unwilling to change or afraid to take that next step to move forward? And as we're shifting to success, it's really focusing on what do we do as a group. We're discussing health disparities. We're talking about the importance of working with people that have different thoughts, different ideas, different needs. But when we're working with organizations, do we actually turn around and look at ourselves as staff members? What do we need to do within the organization to make sure that those programs are not a failure when they hit the ground? What do we do as an organization to make sure that we work cohesively towards the same agenda? And that is to really maintain one vision and one approach. How do we get to that? By taking everyone around the table, everyone that's part of that organization, and really trying to elicit an idea from them, a thought from them, so that it becomes a very collaborative process. We need strong leadership. If it's strong from the top down, if it's strong from the bottom up, those are two different ways. We are only as strong as all of our members. And if we have a weak link anywhere, it is probably through that weakness that we're going to all dissolve and not be able to do what we need to do properly. We need to have standard protocols and procedures, discretionary spending. What do we do with the money that is afforded to us? Do we make sure that it's a very showy program and we spend the majority of our money on a media campaign and becoming well known? Or do we take some of that funding and make sure that it becomes available to those populations that need? Depending on what our program is really seeking to do, that equation is going to shift. Employee development. How many of us have been working in organizations where all you hear is what's going wrong? All you hear is, oh, you didn't do this or you didn't do that. So how about taking the opportunity to also acknowledge the people when they're doing things correctly, that we need to develop them and make sure that every opportunity for training, for growth, for working with other people, for networking, something that's really advocated for as part of this conference. Let's make sure that all of us, again, are working together so that the position that you start with is not the position that you end with, that there's always an opportunity for growth and moving forward. And that we form partnerships and collaborations. As we look around us and we look at the communities that we work with, we realize that many of us may be working on the same products. We're working to achieve the same goal. So how do we find out about all of those things that are available within the community so that we don't duplicate the services, but at the same time we're taking the strengths of every portion of the community, every group that's working together to make sure that we have one very, very strong community working together to achieve the same one vision, one approach. And sometimes it's many approaches that really lead us to that one vision. Again, active monitoring and evaluation, also a very important component of everything. We need to make sure that we keep tabs of everything that's going on, that we evaluate the programs, again, with the idea that we want to make sure that we change things as they go along, that we are flexible enough to understand where we're doing things correctly, but also humble enough to understand when we're not doing it correctly and it needs to be modified. Leadership. I wanted to break everything down into the different pieces because these components become the real essence of what makes some of the programs work. I had the opportunity to work everywhere from an organization on substance abuse to working with youth groups to working both both in Manhattan and in the Bronx on issues around asthma, and it becomes really important. The leadership really sets the tone for what is going to be accomplished and what we will not be able to accomplish. So as we're declaring that vision and the approach, are we setting the guidelines? Are we measuring ourselves by those guidelines and making sure that we are accomplishing the things that we want to accomplish? Are we engaging in continuous discussions, and are we engaging in those discussions productively at all of our meetings? How many of you, again, and it's a rhetorical question, but how many of you have gone to meetings where the only thing that you hear is statistics? This is what we did, these are the numbers that we had, this is all that's been done. But when are we going to engage in a really working meeting to say, these are the reasons why we did not achieve this goal? This is where we're going as a result of this number. These are the different areas where we think collaboratively we will be able to refocus and regain energy by working together as a team. Do we have the knowledge and understanding of the scope of work for each employee? Do we have the ability to report on programs and employee progress? Are we leading by example? So I'm the boss. I tell you what to do. However, I'm on the phone all the time. I don't really understand the vision. I don't really go out to talk to the population that I'm supposed to be servicing. It's really easy to sit behind a desk. It's really easy to spend little amounts of time really engaging the public that you're supposed to be working with. How many times have we actually gone out there and had conversations with those people that we're supposed to be helping? Do we know the faces of those people impacted by asthma, diabetes, cancer, all of the different areas that we are focusing on today and throughout this conference and beyond? Do we have a good acknowledgement of strengths and weaknesses? Weakness is not being able to admit what you don't know. If you go out there and you say, I know everything, that is the first failure, because all of us have the opportunity for additional knowledge, the opportunity to really grow and engage in different conversations that will lead us on the path to something bigger and better than probably any of us could have imagined. As we maintain impartiality, again, going back to that declaration of the vision and approach, we know as a collective what it is that we're trying to do, who it is that we're trying to target. So rather than doing what a lot of times people through human nature end up doing, and that is to engage our egos rather than engage our thoughts. Is it so important to really see whose name will go first and whose name will go last on a publication? Or is it more important to discuss how we're going to achieve this goal so that every single member on that team is just as strong as the next one? We have a lot of strong people working with us. We have a strong leadership. That is the mark of successful programs. And having good judgment. Again, if something doesn't work, how long will we stay with it? Are we going to give it a chance? How long will we give it that chance? And when do we abandon it? Sometimes abandoning an approach is absolutely what you need to do, but making sure that you have good judgment in doing so. When we establish program structure, some of the things that we really have to focus on include populational groups of interest. Who are we targeting? What services will be rendered? Again, what is the mission and vision for the program? Are there similar programs? Why are we going to duplicate services that already exist? Why are we going to compete for clients in a very small community area if we could work with that community, when we could work with that organization and make sure that we only enhance the services that are available? So that we take our strengths and their strengths and we put them together, and we could possibly make a bigger difference with the communities that we're working with. What resources are available? A resource is only available if we know that it's there. You could have the best restaurant across the street, and yet you could be starving. What does that mean? If you don't know that that restaurant is across the street, you're not going to know that you need to cross that street in order to access it. The same thing with healthcare. If we don't know about the services that are available, if we don't take the time to really look a little bit beyond our doors, we will never determine what resources are truly available and what existing partnerships we can engage in. As we set the agenda and we determine the bulk of time that we need to spend on doing a lot of things, what have we done? What are we unable to do? Are we stagnated because of funding, because of staffing, because of all of the difficulties, or are we stagnated because our minds don't let us move beyond the ego? They don't let us move beyond the things that need to be accomplished. They don't let us move beyond some of the difficulties. And as Dr. Wallace discussed this morning, as Dr. Betancourt spoke about as well, communication is absolutely key. If we don't feel empowered by ourselves, what can we do as a team to gain strength from each other? What can we do to move that vision forward and set the agenda the proper way? As we're improving communication, you make sure that within an organization we have email, all of us. We're in the era of technology. So how difficult is it to add one more name, two more names to that email to make sure that everyone that needs to know is absolutely familiar with the materials that they need to be familiar with? How about engaging in conversations? We have fallen into the era of technology, and I'd say it's a wonderful thing, yet it's a terrible thing, because now we don't know how to engage others in person. Why is it so difficult to pick up the phone or to walk to someone's office and say, you know, we have something in common, there's an interest, something we need to maintain. What do we do to move forward that extra step to take us to that formula to success? When we share results, there has to be transparency in management. And we've heard so much through the presidency how important it is to have transparency. How many people that, and again, I pose all of these questions. There are so many people that were never interested in politics before. People who never listened to a news conference before. Why was that? Maybe because the terminology that was used was above their heads. Terminology really meant to confuse rather than to enlighten. Terminology that was used because we want to make sure that a certain small group of people get our point, but those others that could also benefit and dilute those affluent or those that are in the greater categories. What are we doing? Are we really reaching out to everyone? It's the same thing. We're thinking globally as far as the United States, as far as the world is concerned, but we're also thinking on the organizational level. We're thinking on that individual level. What are some of the areas that we need to focus on to make sure that that transparency in management is something that propels us, it makes us move forward in a proper way? The more we know about what is expected of us, the better it is for us to be able to develop a plan to actually accomplish those goals. We're sharing resources. I could hide a piece of paper that has the name of an author. That's wonderful, so I gain all the knowledge all by myself. But then when I need assistance, when I need that team to work together, when I need to promote a certain program, how many people do you think would actually know the information? That would be me, because I hoarded the information to myself. So am I really gaining or am I really losing? Informing or pending changes or challenges? We spend an entire week, and especially during these economic times. It's Monday through Friday, you have work that is 4:45 on a Friday afternoon. It would be nice to get a pink slip on a Wednesday so that at least they tell you, well, you have till the end of the week to work. But how do you feel? Like a slap in the face, right? When it's 4:45 and they say, pack up your bags because at 5 o'clock you no longer work here. When we are losing funding, when the staff will not be able, we'll lose a position and a staff member will not be replaced. When we no longer have access to some of the resources, or a book that was so essential to us, for us to read, is no longer going to be available. If we know about it in advance, we are able to accommodate, we're able to cope with those changes. If we don't know about it in advance, we get taken by surprise. And that surprise generally does not lead to good things. As we have changes in protocols and procedures, how could I comply with what needs to be done if there was a change in the protocol, but someone forgot to tell me about it? So now I am following the old protocol, and I'm doing it all wrong. Whose fault is it? Is it mine, or is it the person who neglected to tell me? And truthful reporting. And we are all, I would say, prisoners to deliverables. We all have to have successes. We all have to show that the money that's being placed in our hands is being used to the best and the maximum that it can be used for. However, when do we go beyond the line? Do we report vaguely? We can do that. Do we show aggregate data? We absolutely can do that. But are we always making sure that the reports that we provide are truthful reports? Are they an accurate representation? If I go out and I see a child who is poor and hungry, and I feed that child, am I able to say that children are not hungry? Am I able to generalize my results if I'm not really focusing on the area that needs to be involved? If I say that the levels of disease, the prevalence of disease has decreased, have I really looked at all of the population? Have I taken a representative sample of that population? And often, we find ourselves stretching that truth a little bit too much, to the point that it doesn't serve our needs, and it most definitely does not serve the needs of the population that needs it the most. Demanding accountability. Accurate reporting, as I just mentioned. Incentives and rewards for good performance. How good does it feel when you've done a good job the entire year and your performance evaluation not only reflects the work that you've done and the effort that you have given, but gives you a reward and incentive? That's money. Sometimes that's possible, sometimes that's not. How about something as simple as a Post-it note on someone's desk saying, "Good job. You're so valuable to us." That is a reward. That is sometimes a more powerful reward than the money, because the money goes away, but the good feeling that you get as a result of that good job is something that could last a whole lot longer. Consequences for poor performance. And again, we have gotten very complacent. So we're not telling people they do a good job, then on the other hand, when they're doing a bad job, it's never pleasant to go to someone and say, "You're fired," or to go to someone and say, "You're really not accomplishing what you need to accomplish." But sometimes it is absolutely what needs to be done, so that we're making sure that we are staying with that agenda. And I just lost my feed here, so if I can get some help, that would be great. Can I just do F5 again? I don't. That's it. Excellent. Perfect. Also reducing internal competition. Competition is a healthy thing, but only when it doesn't lead us in circles. We often, again, ego, need for success, need for individual, a pat on the back, someone to tell us that we are the best, the biggest, the strongest. That's wonderful. But when that competition turns into a catfight, that nothing can be accomplished, that nothing can move forward, then that's destructive. When we have multiple programs and components requiring similar outcomes, again, let's work together to make sure that we're all able to accomplish what we need to accomplish. Let's look at personal qualities, levels of assertiveness, levels of focus. Let's push for recognition and upward mobility. I can have a staff member working for me who could very well be more knowledgeable about a certain area. Am I going to squash that, or am I going to say, you know what, you have such a strength, let's work together, because your strength may be my weakness, but maybe I have a strength that's your weakness, and you bring me up, and I bring you up, and we go up together. It becomes a competition that is not productive when you are saying, I need to be first. I need to be recognized. I'm going to forget to tell someone about it to give me that unfair advantage. Where does that take us? It really does not take us far. But yet we engage in that every single day. And it may be something that's not in our nature. We're not doing it because we're malicious. Some of us maybe. But it's really taking all of those different aspects of our personalities, really taking a collective consciousness, learning a little bit more, thinking a little bit more, being a little bit more introspective to understand what we are doing correctly and what we're doing wrong. So that when we have multiple same-level managers, we're all able to say, we're going to work together so that everyone that works with us is able to see that we are united. And as managers, we will set the example. We will lead by that example so that our workers are able to do what they need to do. Denial. I didn't do it. It wasn't me. Was it you? It was that guy. It was that girl. If we are blind to our weaknesses and deficiencies, we cannot move forward. We need to show positive results, that's absolutely true. But we also need to be confident in the results that we are portraying. We need to make sure that those are sustainable results, that those positive results are actually going to be good for the overall need, for the overall long-term goal. Because we can have many successes on a short-term basis. But if those things don't lead to sustainable products, if they don't lead to sustainable services going forward, then again, the moment we step away from that, what have we accomplished? We're unwilling to identify poorly performing staff. We have fear of demotion or loss in status. So I think that this is absolutely wrong. I think that it's going to be detrimental to the overall focus of what we're trying to do. Yet, I'm not going to stand up and say that I disagree. Why am I going to shine a spotlight on myself if I don't need to? And it's often that complacency, that unwillingness to say, this doesn't work, that again could lead to the failure of a program. And we want to make sure that that does not happen. We have to take into account cultural diversity among the staff. All of these things that we're focusing on, again, as we talk about the populations that we need to serve, part of those members of a population are the staff members that work with us. There is a difference in work ethic, in someone's understanding of how to speak up to a supervisor, of someone's ability to do things independently, of someone's ability to really engage others in conversation and take a leading position. That really depends on many, many factors, and we have to take all of those factors into consideration when we are working amongst ourselves. And how do we find out? Through communication. What works for you? What doesn't work for you? Is there something that makes you uncomfortable? And sometimes those are the very conversations that many of us are unwilling or unable or just very afraid to take. What do we do so that we can move forward? Are we assertive or are we passive? Do we have the power to speak up? Do we have something to say? We have two different aspects. We have those that talk a lot and really know very little, and we have those that know a lot and talk very little. So where is the balance? And that becomes an important issue because we need to empower those that have the knowledge and don't speak a lot. We have to make them feel comfortable within the setting so that they are able to speak their mind, to tell you what they believe in, to tell you some of the ideas that really will make the difference for whatever you're trying to accomplish. Body language. I can tell you something with a smile on my face, but be really mean. I could stay really quiet, yet my face tells you something different. What are the messages that we're giving to each other amongst our staff? What are we doing to make sure that we are not only engaging things that are positive, but also dispelling things that are negative? He said, she said, oh, no one told me. It's about, again, accountability. We are accountable for finding the truth. So if someone does not give you information, and you know that that information is really important for you to know, it is also your responsibility to go seek that information, because you cannot blame the next person for not telling you and say, well, since they didn't tell me, I now do not have any responsibility. You still have a responsibility within your organization. You have the responsibility to yourself to make sure that you are doing the best that you can. And again, that changes with the culture. That changes with beliefs. It changes with sometimes the time that you went to school and what you were taught and what your values are, what you were taught at home. So it's taking all of those things into account and making sure that they work as best as they can. You're always going to find challenges. There's no such thing as an idyllic scenario. However, how can we maximize the benefits and reduce those challenges? And we are probably in one of the worst economic times in a very, very long time. We're going to experience changes in funding. There are grants that will not be renewed. There are programs that will not be supported, programs that we feel are really important programs and crucial to the populations. And which ones do you think those will be? The massive populations, as Dr. Sachs spoke about. We absolutely need to be able to feed children, to provide services to the sub-Saharan African area. Yet, we choose to, for whatever reason, we are not providing those services. Why? So we have to look at those things. What can we do with the funding that we have, with the resources that we have that really work to maximize the benefit, even in the face of the changes in funding? When we have mandatory changes to personnel lines, we realize that maybe we will not be able to impact as many people as we thought. But is it more efficient to impact 50 people in a mediocre way, or maybe 25 in an excellent way? What do we choose to give up in order to accomplish our goals? And when we talk about mandatory changes to OTPS is other than personnel services. And for those of you that have anything to do with budgets, you realize that there's a lot of spending that goes on, everything from incentives to program management that does not have to do with the actual salary of an individual. And sometimes we may not lose people, but we lose our ability to have programs because we don't have that other than personnel funding, and that also becomes an issue. But again, it's about rising above the challenges and doing the best that we can with as little as possible, because sometimes that is all we can do. Acknowledging that maybe it will not be within the next hour, or it will not be something that we can do within the next day or the next year or even the next decade. But eventually, if we have the patience and if we have the vision, it is something that collectively we probably will be able to achieve. And as we're stepping forward, we're identifying the programs, the problems that exist, then we're focusing on solutions for each of them. We're naming staff who can be responsible for addressing these issues. It doesn't necessarily have to be a director. It could be a staff member who absolutely has the right ingredient to follow something through. How can we identify the strength within that person so that they can lead us on the path to success? When we're reconvening regularly to see what progress we have made, again, are we really engaging in the discussion about what we failed to do? What are some of the areas that we need to really exert more energy on? Or are we really just reporting what everyone wants to hear? Are we modifying the structure? How flexible are we so we could attain that success? Are we identifying and implementing measures for sustainability? If we go to a population, one of the things that I've engaged in the past is really engaging families in focus groups, working with them, providing support for them. Because if I teach someone how to do something, and I know that they have learned what they need to do and they are empowered to complete the task, I could step away from that with the feeling that they will be able to continue that process even when I am not there. Because there are changes in funding, you're going to find that some of the programs are only going to be able to follow families or people for a short period of time. And then you need to step away. When you step away, what have you put in place to make sure that it can continue to grow? That the resource, even though you are not there, will still become available to those individuals. And in fairness to all, we say that programs with poor management and structure are usually the first to fail. And as we really think about the issues surrounding health disparities, we realize that all too often, the programs that fail first are usually those for disadvantaged populations, leading to additional increases in health disparities. And we need to be able to provide equity in health. We need to be able to address those issues and very honestly talk about those issues so that we are addressing them as they need to be addressed. Good management and structure together with the necessary financial resources are really crucial. It is the focus on failure that ensures a true model of success, but it is not focusing on failure and pondering on that failure. It is focusing on the areas that don't work, focusing on those failures that will make us stronger because we have actually learned our lesson. And the simple truth, so many of us say, it failed because it's someone else's fault, because I didn't have, because I couldn't do, because of many, many different reasons. But the simple truth is that sometimes failure comes down to just one word, and that is procrastination. And why do I say that? The more we talk about it, the more we can say that we're doing something. But if it's year after year, and I'm still talking about it, and I have not taken one step forward to make sure that I go from point A to point B, what have I actually accomplished? Have I really grown? Have I really made that program successful? And the answer is no. We have the money, it's sitting in the pot. All of us have patted each other on the back as much as we can, and we all feel good. But those people are still hungry. The people still don't have the vaccination and the medications that they need. These people are still gasping for air because they don't have the knowledge to be able to know that they have to take medications for asthma all of the time, even when they don't have symptoms. All of those things really have to be addressed because our procrastination is really what makes it so that those people that suffer from the biggest areas of health disparities are those people that actually suffer the most and have the most to lose. So if we say that planning is really important, and we realize that a plan without action is just as much a failure as having no plan at all. So if we're sitting there with the money in the pot, and we're not challenged to move forward, are we actually doing anything? Are we, if we were to take the theoretical model and we say, what stage are we in? We can contemplate all we want. We know. I smoke, it's bad for me. I'm not going to smoke tomorrow. And then tomorrow, as I wake up, I light up that cigarette once again. I say, you know what, this is terrible. I cannot do this anymore. Tomorrow is another day. And in fact, it is. There's always an opportunity to do something another day. However, there is no better thing than what you can do today. Start moving today. Start going from the point of contemplation and move forward to preparation and take that plunge into action. Because you will realize that what you feel is something that you're doing all by yourself. You look around you and people will follow. If you can show them that it's not just words and there are actions behind what you're saying, you do not have to have your name first on a publication. You do not have to say, look at me, me, me. People will notice, and you know why they will notice? Because it's not about you. People will notice you on the way to achieving the goal that needs to be achieved. And if there's one less child that's hungry in the street, if there's one less woman who suffers from domestic violence, if we have addressed all of the issues that need to be addressed, people will notice you. So in putting your name out there, especially for doctoral students, especially for those that are beginning their careers, really understand what the importance really is. Do you want the glory? Do you want your picture on the front cover? Or do you really want to know that at the end of the day you have made a change? Something that is beneficial to others, something that will work even when you're not there. So that even when your name dims from those lights, that benefit will continue to move forward. And how do you do that? It's really taking all of those things that you have learned along the way, all of those mistakes that you have made, that you have acknowledged, and you have moved forward beyond, and said, these are the things that I have learned along the way that have led me on that path to success. Thank you very much. Any questions, comments?
I just want to say I think the delivery was really excellent.
Thank you.
Pinpointed some things that we take for granted, but that are really, really
And definitely what I'd like to do by that is to start the discussion, to give people things to think about. Because sometimes what is staring us in the face is what we fail to see. The obvious is usually what gets ignored the majority of the time. And if we pay attention to those small details and we focus on those areas that really need just that little bit more of attention, maybe a couple of minutes a day that we can devote to that particular issue, that will make all the difference in the world. And let's face it, sometimes our programs do fail. That is not to say that by following a simple step 1 through 10, you're able to engage in successful products all of the time. But sometimes even with failure, there is success. Because for everything that you are not able to accomplish with one program just leads the way. It's a recommendation for what not to do when new funding, new programs really come together. It may not be you, again. You may not be the one receiving the glory. But it will collectively be a program that led the way, was the stepping stones for something that's bigger and better. And that's really what I'm trying to accomplish by this talk, by really talking about that focus on failure and saying we need to think about those words. What do they actually mean? Are we going to use it to our detriment, or are we going to use it for our benefit? And it's the hope that all of us as public health people, as health educators, as individuals and family members, that we engage our families, our populations of interest, our co-workers in positive ways so we're able to achieve what we need to achieve.
The preceding program was brought to you by Teachers College, Columbia University. Please visit us online at itunes.tc.columbia.edu.